Joining us today is Dr. Richard Leggett. Dr. Leggett is a core faculty member of the General Psychiatry Residency Training Program at Lewis-Gale Medical Center in Salem, Virginia. Dr. Leggett also serves as the Vice Chairman for the SMA Education Committee. So Dr. Leggett, thank you for taking the time today to talk about Overdose Awareness Day coming up on August 31st. So provide just our audience with maybe some statistical analysis of the issue and the societal impact of overdoses.
Well, sometimes the numbers are just overwhelming. It's hard to get a handle on, but we know that especially with opioids, with fentanyl in particular, that there's just almost unimaginable number of folks that are affected by that, and the impact. I don't think it's a coincidence, but believe it or not, 10 days ago, Randy, there was a National Fentanyl Awareness Day, but on the 21st of August, and that certainly is one subcategory of what we're dealing with. We're trying to raise awareness that folks that are impacted, either they've lost a loved one or they've been impacted by someone that has overdosed. It's a really strong and difficult thing to deal with, but we're hopeful that by raising awareness, we'll be able to help provide support for the people that are going through those grieving processes, and we'll also be able to, by raising awareness, can decrease the frequency of the overdoses, and really recognize that if we're not able to provide the mental health services and substance use treatment services, then it's going to be very difficult to decrease the incidence. But we're trying to make steps in all those areas to increase people's ability to get the help they need. The kind of proliferation of substance use treatment programs, especially medication-assisted programs, help to reduce the stigma associated with those deaths, and that's something that not just the patients but the families also deal with, that stigma if they've lost a family member to an overdose. But we need to be aware that is is something that should not be stigmatized, but something that we should continue to help our society recognize that those people need our support.
Absolutely. Yeah. So what are some of the improvements in treatment programs? Anything new that's out that's really making a difference in helping people curb addiction?
Well, some of them are just basic things, like a lot of the previous urine drug screens did not even test for fentanyl, but now, at least at our facility, they've added that to the basic screening test, so that when someone comes in an emergency room and they think that they may have overdosed on something, they at least can identify the substances that they're dealing with. But the fact that you can go to different places for medication-assisted treatment, but also to recognize that there are different levels of substance use treatment, and when people are in a crisis and they're trying to find out how they can get help, that's what we want to do, is to be proactive rather than waiting until the tragedy occurs and the overdose has already happened, and then we're trying to put together the pieces again. So the real key is to be proactive, to identify folks that are starting to have issues in those areas, and to provide that support that they need on the front end rather than waiting for the tragedy.
Absolutely proactive. Are there any kind of strategies for interventions that caregivers or loved ones can use if they feel like there's someone in their family that's struggling with addiction or a potential overdose? Is there strategies?
Well, one of the older strategies is what we used to refer to as an intervention. And that's basically when enough people, usually family, friends, professionals, realize that someone needed to recognize that. And sometimes the patient's the last one that really comes to terms with that. But if you put enough emphasis from a number of different sources, then hopefully that convinces the patient that they really need to get help before it becomes even more of a problem. I think peer support groups help. Support groups, even like AANA, provide a very valuable support and also encouragement and accountability to help folks realize that they're not there alone. But support groups specialize in dealing with grief issues regarding folks that have lost a life, but they also can basically encourage people to seek help and to help the families understand. And so education is always going to be important to realize, number one, that there are resources available and that they can be accessed. And our vision, our hope is that over time there'll be a continued decrease in the number of overdose deaths, and that those that are dealing with those would have the support and the structure that they need to be able to process through those experiences.
Yeah. Eliminating that stigma. This is something that's a lot more prevalent than maybe everyone realizes, and the sooner you can get past the stigma and try to start open conversations, probably one of the best interventions to get out ahead of it.
That's true.
Do you think that the flow of drugs coming into the country and the efforts that we've tried to make to slow that, do you think that's helped?
It probably does help some, and certainly if we can limit the access to particularly fentanyl, then we've got a chance to decrease it at the source. But as we know, probably from the human history, people usually figure out some way to get whatever substance they're looking for. But the harder we can make that, the more difficult. Hopefully, that's going to reduce the number of folks. But even if we could cut it by 50% or 75%, that's still way too many people that are going to be exposed and potentially are going to have overdoses.
Yeah, it sounds like even with those types of efforts, it's going to come down to shedding light on the problem and eliminating that stigma and trying to engage on a personal level, with people that are struggling with these things and getting support. So, resources are good places to go for family members or those struggling with addiction that can go for support generally.
Well, there are some national organizations certainly that help folks, but to me, if someone is in a community and they feel like they need to access resources, that their community mental health board is a place where they can go for a walk-in assessment and have access to services. There's a group called the International Overdose Awareness Day Committee that basically helps to sponsor, and what they recommend is that by promoting community events, just to let people know that resources are available is one way to decrease the stigma and to make sure that people are getting the help that they need.
Excellent. Yeah. Well, thank you for taking the time to talk about this very important issue. And just everyone take the time to recognize this day and try to connect with folks that might need support in this area. So thank you very much again today.
Thank you, Randy.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.